really fun to see all of you. And today, we're going to talk about how nursing can lead healthcare transformation. So, I love this cartoon. Your future in nursing, you will enjoy, oops, it's changing. You will go on a long, oops, it's changing again. So we are right in the midst of an incredible change and opportunity. I have my entire career, it feels as though it's been about, this is nursing's chance. This is nursing's opportunity. And it has been really for my entire career. But I do feel as though the forces have aligned in ways that it really is our opportunity. And it is also our opportunity to miss. What I'm hoping is we're not going to miss the opportunity. So I will give you an example. I had a chance to meet with Sue Birch, and our Colorado leaders here will know. Sue Birch, Robert Wood Johnson Executive Nurse Fellow, happens to be the Executive Director for Policy and basically Medicaid. She is at the table in the governor's cabinet, a nurse who really understands about home care and so wants to make a difference. So how can it be that the Colorado nursing leaders have a fabulous opportunity right here to lead in Colorado and make that difference for how we believe nursing can change? Because so often, right, it's, oh, those people don't understand. How do we get to those policy leaders? And here you have a golden opportunity. So what I'm saying is, for those of you who are in Colorado, how lucky you are, and seize the moment, take advantage, and work with her. And I know Karen Kowalski with the Center for Nursing Leadership and the AONE. I mean, you all are so blessed to have the wonderful leadership that you have. And I just say mobilize and galvanize and go forward as fast as you can, because we want to learn from you. Plus, Colorado, like California and the state of Hawaii and a couple of other states, just received CMMI Innovation statewide grants. Huge opportunity for us to be at the table and to make those changes. So, healthcare reform. That's what we're right in the middle of. And we have an incredible opportunity. But there's some external forces affecting nursing. Lots of them. We have aging population. So not only is the population aging, but so are we. I was just talking to Allison, a wonderful nurse who stopped me to, and everyone's been so terrific, so I thank you for wishing me well and congratulations. But she was sharing with me the challenge of workforce mentoring and the success of leadership. And a whole bunch of nurses, seasoned, experienced nurses, have retired. And the new ones coming in may not obviously be as seasoned. What do you do in a situation like that? It's not unique to Allison. It's all of us. We have to face that issue. And I know with my Southern California colleagues here, from Kaiser Permanente, I do have to give a shout out to my Kaiser Permanente colleagues here. We've worked on residency programs and trying to figure that out. But how do we capture the experience of our retirees who are going to retire, but who may want to work a day or two? And could we capitalize on technology that might take advantage of RN expertise remotely? What could that be? And I'll tell you, having just come from HIMSS, Health Information Management Society of America, I don't have, sorry, oh, this is the part about the videotape that you hate, right? But HIMSS is the technology industry conference, 34,000 people. You name it, they're showing the latest in technology. So I happened to see that one of the systems in California has worked with a vendor to create what they call a virtual nurse coaching software. So the junior nurse gets to access a seasoned nurse via the computer, and if the nurse needs to actually see the patient, that is capable through that technology to bring up the nurse via Skype, and then the nurse can give real-time feedback. I see head shaking. So think about the incredible opportunity we have if we can just break out of the traditional ways of how we think an RN needs to be on site. So much as we're saying, does a physician have to be on site? Does a nurse, an RN, have to be on site? We're going to have to rethink how we do workforce. So lots of different forces affecting nursing, and obviously the economy is huge, huge. Where are the reasons, some people would say, for our budget? And so we have to be part of figuring out the solution. I won't go through this, you all know that. But you know what I begin to ponder about this? If we were to really reimagine how the care is delivered and reimagine what family caregivers could really do, and if you could really reimagine that what we did was really teach the families and the patients how to care for themselves after they left the hospital, in this case because many of us are in hospital settings. Imagine what that would look like if we were to really do it so they don't have to keep coming back to the ED or they don't know what to do. And I've been thinking a lot, you know, we used to have generations that lived together, and so your grandmother or great-grandmother could tell you, don't worry about it, it'll go away. Or I have this remedy in my little cabinet, and that'll take care of it. But we don't have that level of expertise in the home anymore. So how do we recreate that expertise so everybody has it? And how could you do a nursing 101? And if you were to do it, would you need as many professional RNs? And I'm just challenging us. This is what happens. I just start to imagine. So who would be the ones? And if you could democratize the expertise that we had in nursing, so it was available for consumers, but you really had the really specialized high-level clinical care would be reserved then for those who had the time and went back and got the doctorates and the masters and really specialized skills, because it would be too much for everybody to know. But how could we begin to do it? If you look at other industries haven't kept that knowledge unique just to that profession. We're one of those few in healthcare where we've kept the knowledge so specialized. So think about how we might do that. Because if we did, the RN workforce, we might imagine the shortage in a different way. Just to think about it. So the IOM, Future of Nursing Report, and we have lots to thank Sue Hassmiller from the Robert Wood Johnson for this fabulous work. She has been the person behind this and has really just steered it so well throughout this country. Bill Novelli, who is the former CEO of AARP, I loved when they did the press conference. And this is what Bill said in terms of the report itself. Now, how many of you have heard of the Future of Nursing Report? Okay, good. I should have done it the other way, but it's kind of nice to do this because you kind of knew. So, but isn't that terrific? That report came out in 2010. It's terrific that you all know about it. So what I loved about what Bill had to say is that nurses, so he's not a nurse. He was the CEO of the AARP and sat on the commission. Nurses can be so much more in way of leaders. Nurses have to step up and take a greater leadership role. And nurses must lead in boardrooms, in C-suites, in legislatures. Nurses have power and nurses have force. this is what is so important. So here was Bill Novelli, former chair of the AARP, telling us, step up. Step up. So we have to get past, oh, woe is us. Because you know what? Nobody is saying that anymore. I'm not hearing it as much. It's move. Okay, let's hear your ideas. Let's hear them. I hope Linda Everett won't mind, but I'm going to share a little story. See, you have to be careful if you stop me, because I might talk about you in a conference. But Linda Everett was telling me that she's so happy with what she's doing at her system, because she's got pilots going, and she made a very astute comment. I'm not going to wait for them to ask me or tell me I need to cut my staff. I am going to be out there being proactive and thinking about how I can reimagine what the care should be, because I think this is what works best for patients, and come in at an affordable price, because we do have to be part of the solution. I remembered we in nursing, we were the ones, you name it, we can do the workaround. You name it, we don't ask for extra money, we just do more, right? So the country is looking to us for our talent in really being able to figure out how to do that in a cost-effective way. So again, we have to step up. Now, I won't have to go through this because you all know this. All of you through your action coalition. So how many of you are active in action coalitions? That's terrific. I wish I had Sue here to let her know that you're all so active. And hopefully, you're really using that to mobilize and to help make that change. I would love to see us get beyond the education issue. We do need to push it, and we do need to have more advanced practice nurses, but I wish we could get into the delivery care redesign, because that's where the action is. We have to figure out how the care is going to be delivered in a different way, and we have to do it now. So this is what we have at Kaiser Permanente in terms of our nursing vision. Kaiser Permanente nurses advance the art and science of nursing in a patient-centered healing environment through our professional practice and leadership, extraordinary nursing care, every patient, every time. And believe me, we labored over every single word. Every single word means something. And so we were very pleased about it. And then, you know, we sort of compare what Florence Nightingale and all those, just think, all of those that she was pushing forward back then, still relevant now. And hopefully you've read the book put together by Alex Attewell through the Sigma Theta Tau on Florence. And if you haven't, you really should. It's a small book, but it's got her wonderful quotes. And I read that, got to be a reviewer for it, and was so pleased. And I thought, geez, it's still relevant now. So that's our legacy. And nursing, through the IOM report, clearly says we should be full partners, and I think it's our own mindset. We have to get past it and believe we are partners. And I'm not hearing anybody, as I've said before, say, don't tell us your ideas. They're just saying, well, come forward. And I challenge us at Kaiser Permanente to do more of that. You know, we need to do more, and we're working as hard as we can, but we know there's more to do. So what about transforming nursing practice through innovation? We have a number of things in terms of expanding roles. We have patient-centered medical home in one of our sites in Southern California. We have nurse-run clinic. I wish we had more, but I'm sure all of you wish you had more of whatever it is that you think is neat. But we always have to manage all the politics of how you actually move something like that. But we have patient-centered medical home model, nurse-run clinics. If you don't know Patty Garrity's work at 11th Street Center in Philadelphia, 11th Street Clinic, you should take a look at it. It is just a terrific program. I think it's an Edge Runner program out of the American Academy of Nursing. our smart care strategy, this is a Kaiser Permanente strategy that we started a couple of years ago when we saw that there was so much happening in technology that we needed to be more deliberate about what it is we were doing. And so we set about a initiative to really go through all that, and we had sessions at our Garfield Center to talk about it. So we're working on that. Part of that is the patient room of the future. We're working on transitional care models, and our other three, NKE Plus, is basically a simple shift report, but it was done by really doing it in a systematic way. I can tell you more about it. KP Painscape is our way of measuring pain and then hooking that up to our electronic record. And MedRite, most people notice it from the sash. That's a do not disturb, and that's kind of a fun story because we had a lot of ethnographic research done. We brought the nurses to the Garfield Center, and one of the nurses put on a sign, said, "Do not disturb me." And we thought, now that's a sign about what the medication administration process was like. And it turns out the nurses were being interrupted a lot while they were doing medications. So that's our process there. I want to, before I close, just mention the interprofessional collaborative practice core competency domains. Have you heard of the interprofessional team-based work and core competencies? If you haven't, stay in touch with this. HRSA just funded the National Center for Interprofessional Practice and Education, and they were deliberate about practice and education, practice before education. They realized, and I think for those of you, and it's fun to see that we've got educators here, we have to partner education and practice. It cannot be in separate silos, and it can't be in separate silos with different disciplines. There's a lot of work that's coming out. Macy Foundation just sponsored a conference in January related to interprofessional education and practice, and their findings, the summary of the report will be coming out shortly. So pay attention to that. We're hoping that will also stimulate more work in terms of interprofessional team-based care. So I firmly believe we in nursing can lead this transformation that this country so desperately needs, but it's up to each of you and each of us collectively to make that happen. Thanks.